A section-by-section critique. RDA Confusion. Denise begins by pointing out that the RDA for protein is the minimal amount to meet the nutrient requirement rather than the optimal, which is what I claim in Proteinaholic. This is a bit of semantics, but I hold by my statements, though a slight rewording may be called for. The Food and Nutrition Board of the U.S. National Academy of Sciences arrived at their protein recommendation after reviewing many different studies. They have re-reviewed and revised their recommendations several times. They calculate recommended protein consumption based on the amount of protein that is lost daily and needs to be replaced. The obligatory losses, such as found in stool, urine, feces, skin, and hair, were estimated to be, in the average male, 24 grams of protein a day. The RDA is designed to ensure that the vast majority of people eat adequate protein, so they assumed a normal curve, calculated standard deviation, and then added 2 times standard deviation. In other words, the average man's protein requirement is right at the top of the graph, at the end of the red arrow. Half of the male population requires less protein, the area to the left of that center line, and half requires more. So what does it mean to add a standard deviation to that requirement? Without getting too technical, you can see standard deviations in the graph above. Each vertical segment represents 1 standard deviation. So let's look at the graph again, this time with the RDA set at 2 standard deviations above the average. The percentages within each vertical segment refer to the percentage of American males whose protein requirements are matched by that segment. In other words, the 2 dark blue segments, representing 68.2% of the US male population, are within 1 standard deviation of the average. By placing the protein RDA 2 standard deviations above the average, the Food and Nutrition Board is recommending a daily protein intake that is actually higher than that required by 97.8% of the population. This brings us to 31 grams of protein as being the most amount of protein lost per day by any given person. They then estimated that only a certain percentage of dietary protein is actually absorbed and utilized, which is how they arrived at the 56 grams recommendation for an average male. But this is not a minimum value. If you ate 50 grams of protein per day, you would more than likely be fine. The 56 grams is a cushion to be sure nobody is truly deficient. Now, is it an optimum value as I claim? I can see Denise's point that it is not. The RDA is meant to be enough protein, which implies it is a minimal number, and for a population as a whole I grant she is correct. However, that 56 grams of protein assures us that 98%, 3 sigma rule of the population, is getting enough protein which is optimal for covering our bases. Or explained differently, statistically you have a 98% chance that you can eat less than 56 grams of protein and yet still be consuming adequate amounts. As I point out in my book, there have been numerous reviews that have demonstrated these values to be more than adequate. The RDA never attempts to delineate an upper limit of protein, nor does it consider what constitutes an optimal level of protein. Built into the RDA is an implicit assumption that more, if not better, is definitely not worse, which is where Proteinaholic comes in. The whole point of my book is that there may be risks with higher levels of animal protein. When we perform a risk to benefits analysis, 56 grams consumption has very little risks and yet is completely adequate for day-to-day life and is therefore an optimal level. I would not argue that it is optimal level for an athlete, but that is a whole other discussion. Number 2. Lester Morrison, low protein pioneer or misrepresented researcher? To be honest, when I read this section of Denise's critique, I thought to myself, who the hell is Lester Morrison? I could not remember studying Lester Morrison at all. When I looked at the section of the book she was referencing, I realized I had never reviewed Lester Morrison's work and was actually discussing him as an influence on Nathan Pritikin. I never actually read the study, so did not reference it in the book, but alluded to his study as I had read it discussed in Pritikin's book. I find it strange that this is the number 2 criticism of Denise's and is demonstrative of her focusing on small issues and missing the big picture. This study was not part of my overall thesis and could have just as easy been left out of the book. That being said, for the purposes of this response, I attained the actual study at a cost of $30. This was not a great study, but Denise is right in that Morrison's main arguments were that reduced fat diets could reduce heart disease. However, she claims that his low-fat group was eating 120 grams a day of protein. Maybe we are reading different things, but his study explicitly states that his experimental group were eating 90 grams of protein and 320 grams of carbs. Denise lists various foods that were allowed, which makes it look like this was a high-protein, low-carb diet, but that was just not true. An example of the diet given was breakfast, shredded wheat with skim milk, wheat toast and margarine, and orange juice. Lunch was pea soup with skim milk, 2 ounces of meat or cheese, lamb, string beans, salad, wheat toast, and canned pineapple, and dinner could be 2 ounces of meat, salad, veggies, bread again, and lemon sherbet. Hardly high protein. Secondly, they limited the fat to 25 grams and limited cholesterol intake to 50 to 70 milligrams. They don't give us details on the actual diet of the controls, but we are told it was their usual customary diet and consisted of 80 to 160 grams of fat and 50 to 70 milligrams of cholesterol. They don't tell us the usual protein, but understand that cholesterol comes exclusively from animals. Also, most of the fat consumed at that time came from animals, so it would be extremely difficult to reduce cholesterol and fat without reducing animal protein. I suppose if they ate a lot of egg whites and skim milk, but that is not what their sample diet looked like. Several times in Proteinaholic, I alluded to the fact that it is difficult to separate protein from fat to see an isolated cause-effect relationship. I grant Denise that Lester was interested in fat, but the 90 grams of protein would hardly be classified as high protein, and I am not privy in this JAMA study from 1960 to the actual diet of the control group, but given the much higher cholesterol intake, I must assume they ate more animal protein. Nonetheless, I had not subjected this study to the same rigorous investigation I did the actual studies used in the formulations of my arguments. Denise is correct in pointing out that the study was designed to look at lower fat, not lower protein. Number 3. Do non-human primates prove that we can thrive on low-protein diets? This is a famous argument in the nutritional science world. Specifically, does looking at the anatomy of various animals and comparing them to our own give us any information on what we should eat? Denise challenged my agreement with Sylvester Graham's assessment that orangutans and gorillas prove you don't have to eat meat or dairy to build muscle. We can write a whole other book on this isolated debate. First off, the section where I discuss comparative anatomy was used to show that despite the common argument by meat eaters, we are not carnivores. I provide multiple examples of how we are nothing like carnivores, from our acid levels to our enzymes to our modes of mastication, etc. Read more in Proteinaholic. Denise spends some time arguing that we are very different to apes because we have more small intestine and less colon, and she is correct in fact, if not in interpretation. My argument is our physiology is far more like a chimp than it is a lion. If you look at small intestine length compared to body length, a carnivore has 3 to 6 times the size of small intestine. The herbivore has 10 to 12 times, the usual omnivore has 4 to 6 times, and we have 10 to 11 times. Comparing carnivores, herbivores, and fruit eaters, we are far more like the fruit eaters. I'm not sure where Denise is going with this hindgut theory, because we too are hindgut fermenters. Maybe not as efficient as an ape, but hindgut fermentation is mainly good for production of volatile, short-chain fatty acids that can be absorbed and utilized as energy. Here's the key problem with her theory. Hindgut fermenters do not absorb more protein. Even humans can have greatly varying sizes of colons, which may be genetic or adaptive based on diet, but you wouldn't say one human is completely different from another based on size of the colon. Denise does point out a valid fact that chimps and apes graze all day and consume huge amounts of food and therefore can get more protein. But she seems to imply that they eat a lot of meat and insects. Jane Goodall was the first to note that chimps do organize hunts and that they use sticks to fish for termites, but she noted this was a small amount of what they eat. In fact, observations of primates in the Congo show that they gravitate far more towards fruit and are not driven by protein consumption. When fruits are plentiful, apes will mainly eat fruit, especially figs. In Uganda, while they eat 102 different species of plants, half of all food consumption comes from varieties of figs. Their percentage of protein consumption will drop down to 15% or less during plentiful fruit availability. When fruit is not available, their consumption of higher protein vegetation will dominate. Meat makes up only 3% of their diet or less, depending on which primate and what location. There is obviously a huge variation in diets, but plants dominate regardless. So, when Graham says that apes and orangutans prove you can build muscle without meat and dairy, he is most certainly correct. They have far more muscle mass than we have, and they eat far less animal protein. And though we are different than the primates, they are by far our closest relatives. Number 4. Sugar, inflammation, and funding foibles. I am sorry to say it, but Denise demonstrates her inexperience in this section. First off, she suggests that I didn't read the article. This is a bit ridiculous. Anybody who knows me or my writings knows that I dissect these articles to pieces. She accuses me of only reading the abstract. However, my mode of evaluating the literature is to skip over the abstract and head straight for the methods and results. The data and the design are objective. The rest of the article is subject to interpretation. Denise implies I am hypocritical because this study, she says, was funded by the sugar industry. The study was funded by the Danish Research and Development Program for Food Technology and a sugar company. Coke provided the soft drinks. That being said, the whole design of the study was created to prove that sugar causes inflammation. In fact, the authors refer several times to a previous observational study that showed that people who ate a high glycemic diet had higher inflammatory scores, and this study was designed to test that hypothesis in a randomized controlled fashion. I actually felt that the authors massaged the data to try and find a correlation where one simply did not exist. I will explain later. In addition, Denise obviously does not know the authors, but I do. Arne Astrup, the lead investigator, is a highly respected researcher and someone I have found to be completely unbiased. He is certainly trustworthy. His design for this study was excellent. Double-blind controlled trial where they were giving the experimental group 125 to 175 grams of sucrose a day. This group drank an estimated 1.3 liters of Coke a day. The control group was matched perfectly but used artificial sweeteners. They went to great lengths to be sure that the two groups ate the same amount of protein, even checking their urine to be sure it correlated correctly with their reported consumption. The experimental group was consuming a huge amount of sugar. The research I presented in Proteinaholic just before discussing this article showed that even small intake of cream will increase inflammatory markers. Can you imagine what 1.3 liters of cream would do? If sugar is the cause of inflammation in our bodies, then surely the intervention group should have huge inflammatory responses. After 10 weeks of consuming 1.3 liters or more of Coke and eating even more sugar, the experimental group gained weight. Of course they did. The energy density of their food drink was much higher, and they were consuming far more calories. So not only were they consuming huge amounts of sugar, but they were fatter. We know fat actually secretes inflammatory mediators, so they must have more inflammation, right? Well, after 10 weeks, the CRP actually decreased in the sucrose group. The authors note that there were 4 subjects whose CRP results were not reliable, so they were removed from the study. After this adjustment, they found that CRP increased only 6% and the p-value was 0.17. What this means is that the result is not significant and could just be from chance. They note that weight had no effect, which is strange to me. I think this is because of the use of ANCOVA versus multivariate regression and type 2 error of low power. The authors note that the low number of subjects may have caused the lack of statistical significance, but I would argue that the more subjects that they had, the more you would see that the weight gain, more than the sucrose, would affect the CRP. That being said, this study, despite huge sugar intake, did not show sucrose significantly increases CRP. Haptoglobin, another marker of inflammation, did increase but was found to correlate with energy intake, so it may have increased in sucrose group just because they were consuming more energy. Finally, transferrin in a negative acute phase reactant, meaning its level should drop if inflammation is occurring. The authors specifically note that it was contrary to our expectations that the transferrin value went up in the sucrose group, though this could also have been due to a relationship with energy intake. Denise takes a small excerpt from the study which says that sugar-sweetened beverages may increase inflammation, but fails to convey their final thought. The relative changes in inflammatory markers in the present study were small. Even though the between-group differences in haptoglobin and transferrin were statistically significant, it is doubtful that these differences are biologically important. Not biologically important? Exactly. Sugar in this study did not increase inflammation significantly. Oh, I almost forgot. Not only did the high sugar not cause high blood pressure, but it also did not increase insulin resistance. As I wrote in Proteinaholic, it's the meat that makes you sweet, not the sugar. Again, this was just one study in a whole line of reasoning that clearly showed that animal consumption increases inflammation. It was used as an aside to note that sugar, commonly believed to be the source of inflammation in the diet, does not appear to cause inflammation in a randomized controlled trial. This was a study performed by a top researcher, published in a top journal, and I stand by its relevance in this book 100%. Number 6. Wheat and the China study. Again, I made a quick, very small reference to Denise's erroneous criticisms of the China study. She jumps on that small reference with several pages of critique. This has been hashed out countless times on the internet, and I simply do not have the time to go into detail on this one. I refer you to Dr. T. Colin Campbell's response. As mentioned previously, I have also enjoyed reading Plant Positive's blog, another blogger without the usual credentials, but who does a fantastic job analyzing data. He did a thorough review of Denise's criticisms here. And now for intermission. As much as I enjoy reviewing the literature and engaging in highbrow discussions, I am a very busy physician, training for triathlons, who also has 2 kids who want me to go play basketball. The next part of Denise's criticism gets to the heart of her background and will provide some interesting debate.